There is global concern over the lack of psychosocial care and support within society, resulting in the perception of men as perpetrators without a proper understanding of the root cause of their behavior. The UK's global health lead, Clive Ingleby, is encouraging organisations to create support groups to help children, families and communities to improve psychosocial well-being, which in return will enhance connections between people and build a better sense of self and community.
I mean, there is evidence to show that women that have been exposed to long-term sexual or physical abuse are more likely to develop a range of different mental health conditions. So this is why we need men to understand that the consequences of their actions can be very serious on a woman's long-term mental health and well-being.
In the promotion of psychosocial support, Ingleby says his organization initiated a program called the Husband School, aimed at inspiring men to be the best husbands they can be to their wives. He said following his presentation at the forum, he was approached to roll out the Husband School initiative in more countries.
And at this school, the men go along for 6 months and learn what it means to be a good husband. So they receive training and information and updates from a range of different technical experts in issues like sexual and gender-based violence and how that impacts on women, sexual and reproductive health and rights of women and girls, addressing issues around female genital mutilation, how to be a good husband, how to negotiate sex and not to force sex, how to look after children, how to carry the burden of the household chores, how to ensure that they budget and give money to their wives to enable them to feed the families, rather than going out, for example, and maybe gambling or drinking or spending the money on other women.
Ingleby also spoke about poor mental health, which he said is prompted by social perceptions, terming it toxic masculinity.
I would encourage them to get involved with organisations like REPSI, who are running the forum that we're all attending this week. Look out for organisations that are already promoting and thinking about the issue of mental health. And think as a country, we're very good at kind of thinking about how we address physical health challenges. You know, there's been increased investment in community health services, in tertiary health services for physical ailments. We talk about HIV, we talk about TB. These are real, genuine health issues, particularly for the SADC region.
The forum is held under the theme Breaking Barriers, Creating Connections. He called for an openness to initiatives that may groom men into psychosocially abled beings, which may in return break the cycle of violent behavior towards women and girls. Queen Avuya, NBC News, Windhoek.